Hi, everyone, and welcome. We will wait just a few more minutes and let a few more people join. All right. Just give it one more minute, and then we'll get started. All right, welcome to those that are here. We are just going to give it a few more seconds and let others join, and then we'll get going. Great. All right. Well, everyone has a busy day ahead of them, including us. So let's get started. Welcome, everyone. A few housekeeping matters for the webinar. We encourage participants to introduce themselves in the chat. I see many of you are already doing that, so that's great. As we get going with the webinar, if you have questions, please use the Q&A function to put your questions in. And that way, some of our moderators, if it's an easy question, can answer it directly for you. But we can also put it into our lineup of questions for discussion at the end of the webinar. Today, we will have an overview followed by presentations by 4 panelists, and then roughly 15 minutes for discussion and Q&A. Throughout the course of the webinar, participants will frequently hear the letters TCG. TCG stands for TB Commitment Grants, which are USAID fixed amount awards. And I'll find a way to say that as others join. I think many people are familiar with fixed amount awards. At TIFA, we call them TB commitment grants. They are, in fact, the same type of award, just a different name for our particular project. Today's webinar, Localization, a Pathway to Strengthening TB Care, will showcase how the USAID Tuberculosis Implementation Framework Agreement Project, which we call simply TIFA, offers an example of how USAID is realizing its commitment to localization through an unusual mechanism that puts national health systems and country TB leaders in the driver's seat. Briefly, TIFA, which is led by JSI and partner Open Development, is not an implementation project. We are instead a funding project that provides fixed amount awards called TB commitment grants and other awards to national TB control programs or country-based local organizations so they have the resources they need to accelerate progress to the NTB goal. Essentially, TIFA responds to country demands, lets countries lead grant design, provides funding, and then we get out of the way and let NTPs and their partners get to work, though we are always beside grantees as a supportive partner. It is in this way that TIFA embodies the spirit of USAID's localization policy. In this webinar, panelists will cover supporting locally generated solutions. Can we go to the next slide, please, Aminata? Great. Supporting locally generated solutions, creating effective partnerships between national TB programs and civil society organizations, establishing pathways to sustainability, and catalyzing investment to mobilize additional resources. Next slide, please. Great. My name is Rebecca Firth. I am the Director of Capacity Strengthening and a Senior Country Support Manager for the TIFA project at JSI. I have the pleasure today of co-facilitating this webinar with Edmund Ruta of USAID. Edmund, over to you to introduce yourself and tell us about USAID's TB Accelerator.
Sure, thank you, Becky, and welcome everyone. So my name is Edmund Ruta. I'm a Senior TB Technical Advisor on the USAID TB Division here in Washington. Part of what I do is also to support TB Implementation Framework Agreement, TIFA. And thank you, Becky, for really doing a good job on putting ahead all those acronyms which you're going to use throughout these presentations. Next slide, please. So just to make sure that we set the stage for this presentation, in 2018, USAID launched the Global Accelerator 20B program. This was to respond to the UN high-level commitment to really advance an NTB around the world. So the Global Accelerator has many components. I think one of the two components that have really advanced the local agenda is the TB local organization network, TB Loan. Some of you come to know it, but also TIFA is another big pillar of that approach. And then we have other components. But I think the key to this particular business model is to transfer the resources and implementation to the national TB program and local organization and ensure that they accelerate everything that they need to do towards ending TB. So part of that is to develop a really good system and ensure that not only we sustain the effort to NTB, but I think we develop the capacity at the local level. So that's what TIFA has been and continue to really do in terms of local organization pathway for USAID. Next slide.
Great. That's back to me. Thank you, Edmund. All right. So just to give a brief overview of TIFA, as the map on the slide shows, TIFA is a global project. At present, we're covering quite a bit of Eastern, Central, and Southern Africa, as well as Central Asia, South Asia, and East Asia. And TIFA's approach is centered, as I mentioned before, on demand-driven funding, co-design, and partnership, which underscores trust and capabilities of governments and their TB partners to effectively identify needs, manage funding, and implement their programs to improve TB care and treatment in their countries. So our whole focus is the underlying belief that countries and governments know what they need and have the skills to do it. And what we need to do is provide them the resources to help them move that forward. Next slide, please. Of the 24 USAID TB priority countries, at present, TIFA is functioning and operating in 17 of these countries. We initiated our project in 2019, and we have been extended through 2027. And so in the first 4 years of the project, we have provided now over 120 subawards and growing. Actually, in project year 4, we provided as many grants and awards as we had in the previous 3 years combined. So we're in a period of rapid acceleration. For these 120 awards, we have issued over $21 million of US government funds to grantees. And just for a little bit more detail on what these funds, who these funds go to, 93% of subawards have gone to local partners. And subawards includes both TCGs, fixed amount awards, and other awards. At present, 108 of those 120 awards are in fact fixed amount awards, and 12 are contracts and other subawards. And basically, TIFA is designed to provide TCGs or fixed amount awards, but there are cases in which that is not the most appropriate mechanism. And when that happens, we can be a bit flexible and use other types of USAID awards to fund activities. So 93% of all subawards have gone to local partners, and 97% of TCGs have gone to local partners. We have provided grants and awards to 51 recipients, and 54% of recipients of TCGs are government partners. 48% of all subawards are government partners. So of those local partners, those 97, majority are also directly to national TB control programs or other government entities that are implementing on behalf of government partners. Next slide, please. Fantastic. All right, because TIFA is demand-driven, we do not actually dictate topics for funding. And we don't have a specific scope, aside from it has to have something to do with TB. But instead, we respond to the requests of country partners. So frequently, the topic or the issue or what is to be funded is negotiated with the USAID mission and a national TB control program, sometimes even in advance of when TIFA is invited to come in. Generally, grants have been funded in sort of 4 buckets of interventions. So as you'll see here on the slide, health systems, service delivery, research and data, and diagnostics. So Examples include, on the health system side, human resource strengthening, training, support supervision, cross-border collaborations, and policy development are among those. We also have quite a bit, it's under the research and data, but quite a bit in data, which would also fit under health systems. Service delivery, we've covered TB contact investigation, sample transportation, active case finding, TB preventive therapy, and DRTB interventions. Research and data, everything from program assessments to large-scale studies of TB mortality, which was done in India, studies on different approaches to active case finding in countries, monitoring and evaluation, data reviews, guideline development, monitoring and monitoring systems development, information systems development. On the diagnostic side, we've supported interventions to improve pediatric sampling, gene expert, X-ray procurement. So we've procured for several countries digital X-rays with AI software, training and diagnostic network assessments. So it's really broad, which is wonderful because it gives us the opportunity to truly respond to whatever the country's particular need is for the moment. I should mention here before we move on, most of our awards are short term, so we try to fund things that can be completed within a 12-month period. This is very suitable to a fixed amount award, but even for other awards, we try to make sure that what is being funded is achievable, is practical, and can be carried out in a discrete amount of time, typically about 12 months, sometimes a little bit more, sometimes a little bit less. Next slide, please. Back to you, Edmund, to introduce the panelists.
Thank you. No, I'm very pleased to introduce our panelists today. So I'll quickly run through them. So first presenter today is my colleague, Dr. Min Nguyeni, who works with the USAID TB division and serves as the Agreement Officer Representative for TIFA, AOR. So Dr. Min this morning will be presenting on behalf of Dr. Bhavin Vadera from USAID India, who couldn't join us. Our next panelist is Dr. Elton Montgomery, who serves as the senior lecturer and head of department for the health sciences and public health at the African University in Zimbabwe. Dr. Montgomery has extensive experience in TB research and TB program implementation, and he currently serves as the TIFA program manager in Zimbabwe. Next is Ms. Shoksanam Alimejanova, who is a TIFA TB program manager at Uzbekistan National TB Program. She has 70 years of experience in public health and served as a coordinator for our first TCG agreement in Uzbekistan and currently coordinate all the TCG in Uzbekistan. Welcome. And last but not least is Professor Moses Joloba, who currently serves as the director for the National TB Reference Laboratory and the Supranational Reference Laboratory in Uganda. He also serves as the professor for microbiology and immunology and the current dean of School of Biomedical Health Sciences at Makerere University. Thank you, all the panelists, and over to the first presentation.
Great. Our first presenter is Dr. Min Nguyen on using TB commitment grants to support locally generated solutions aligned with India's TB National Strategic Plan. Min?
Okay, thank you. So I'm hoping I can do justice to the presentation that our colleagues in the Indian mission and in the CTG has been able to put together. Over here, we're going to describe how the CTG has utilized the TIFA mechanism to support and generate multiple solutions to their program. So the key thing here for the Indian mission is that the Indian mission isn't dictating how it wants things done. It's for working within the local partners, within the NGOs, within the CTD themselves, to identify gaps within these TB programs, to identify issues that need to be addressed, and identify knowledge gaps, identify like service gaps, and then they develop an RFA, path selection process that local organizations within India can develop and submit applications on how they hope to achieve and address these problems. So you using the open calls for proposals on the TIFA head website, as well as other places where they can post the RFAs and the notice of funding opportunities. Local grantees, such as like faith-based organizations, research organizations, service delivery organizations, can come up together proposals to generate these awards, grants out to there, so they can implement solutions for the programs within India. Once the selection process goes through, the TIFA works very well with the CTD and the local apparent successful awardee to design the award so that one, it fits the needs for the India CTD, as well as is applicable and reasonable for the grantees themselves. And so the recipients of these organizations, such as non-governmental organizations, private institutions, and the CTD work very closely to help design how the programs and the funding would be utilized within India. So you can see on the next slide, we'll go over all the different operable items that the CTD and the India mission has developed in its funding through TIFA. This falls into three main buckets: demonstration of operations. So this is addressing all these things stay on the slide. I'm not going to go through each slide item because there's so much, but you can see here just the breadth of the items they're addressing, as well as the multiple solutions involved. So all these are actually solutions and programs designed by local awardees within India to address needs that the CTD has generated. And this has been a very great partnership within the CTD and the local solutions, these local organizations, to develop a program that especially one can be locally generated, two comes with solutions that are unique to India and thus able to be more efficient to address the items that the CTD has highlighted to be addressed, as well as to being able to follow up on this. And so this has been great in helping TIFA to work well within the India mission. Next slide. So the key thing about the India program is that all the solutions have been developed locally. So TIFA works closely with the government of India, as well as the NSPs and also the local partners, to make sure everything is cost efficient, everything has been well designed, and everything has well indicators and measurements that are applicable and ownership of all the local stakeholders. So because the local organizations develop these programs, they completely understand and take full ownership of their deliveries for this. All the things that TIFA operates are milestone based. So they are responsible for achieving all their milestones and making sure that if they complete their needs, as well as these things are quality checked by the CTD, then they are able to be paid out for these. And because the local organizations develop their own milestones and develop their own payment plans, as well as the finances and the budget for this, it all comes within reason, and they are responsible themselves for managing their own costs and budget for these activities to make sure those milestones are achieved. Everything is done through a co-creation process. So we make sure that the local organizations have a full voice in developing these solutions, as well as using the convening power of the TIFA India government to make sure and have the connection between the CDD, Central TB Division, as well as the local organizations. So hopefully that unfortunately conveys a large portion of what India does, but it conveys how important the TIFA program is and how important local organizations are in this process. Back to you, Becky.
Thank you, Min. That was great. And I have to say, as a backstop for that India team, it's really exciting what they're achieving in India. And it is TIFA's largest buy-in, but they are moving incredibly fast and just doing some really exciting things. So I recommend everyone sort of keep watch on what's happening there. Our next presenter, next slide, please, Aminata, will be Dr. Mugumeri from Africa University, presenting on creating effective partnerships with National TB Control Program leadership to develop and implement TB commitment grants. Dr. Mugumeri, over to you. Dr. Mugumeri, are you still with us? If you are, you may be muted. Yaritza or Aminata, can you see Dr. Mugimeri still?
No, he may have dropped off.
Okay, let's move on to the next presenter. If you could go through the slides, and we'll come back to Dr. Mugimeri if he can get reconnected. I'll reach out to him separately. So we'll switch then and move on to Ms. Shoksanam Alimjavana, who is the Uzbekistan National TB Program consultant, I believe, leading up all of the TIFA funded grants. And she'll be presenting on using TB commitment grants to create a pathway to sustain TB services and activities. Shoksanam, over to you.
Thank you. Good morning and good afternoon. My name is Shoksana Marimjanova. I am the TIFA project manager in the National TB Program Uzbekistan. I would like to extend my gratitude to the organizers for giving me the opportunity to share our country's experience in this significant webinar. As you know, the TIFA mechanism was launched in 2019, and it's remarkable that Uzbekistan became the first country who received fundings. Speaking out of our country, the population is 36 million. We started piloting in 2021 from the one region called Tashkent region. Then in 2023, experience that was accumulated in the first pilot is now transferred to the new region. Next slide, please. This is a very demonstrative slide where you can see how our activities unfold over time and areas. A memorandum of understanding was signed in January 2020. In total, funding was allocated for 10 TB commitment grants. Some of them have already been completed. And as you can see, we divided the areas into three groups. First, it's improvement TB services. Second, research. And third, it's knowledge transfer. In the first group, we are working to improve comprehensive TB services, TB contact investigation, and pediatric TB detection. We also conducted 3 TB commitment grants in research and innovation group. Next slide, please. The project has a very important catalytic role in the TB program, and this slide outlines the comprehensive strategy for sustained TB services, emphasizing a multi-phased approach. The pathway has 5 key components. First, it's integration with existing health systems. Second, it's capacity building, where we invest in training and capacity building for healthcare workers involved in TB system. Third, it's community engagement. Four, it's technology integration, where the first ultra-portable X-ray machines in the country were purchased. And the last is the research and development. Next slide, please. At the regional level, we have summarized the project role in improving the range of TB services in this table, where you can see the key stakeholders and examples of cooperation and in coordination, training, equipment and service, and monitoring. For example, effective engagement with the health authorities led to an increase in funding for additional equipment, consumables, and their involvement in solving emerging issues. Next slide, please. Now you will see what the project contributes in different areas. TIFA launched the Sputum logistics system when the global funding request form was being developed in 2021. Negotiations were reached with the GF that TIFA will be the first who launched the logistics system, and then knowledge and experience of the basis of which the global fund would support expansion. And this is exactly what happened from the second quarter in 2022, when in 12 regions of countries, samples logistics were launched under the Global Fund. The next point is diagnosis of TB among children using the stool test method. The Global Fund is currently planning to expand this activity through the whole country. The next, it's TIFA purchased the first ultra-portable X-ray machines, the experience of using which made it possible for the NTP to expand through the country within the framework of the Global Fund. And additional 15 systems were purchased. And the new funding request for 2025 includes 28 more X-ray systems. And answering the main questions, have TCGs created a pathway to sustain TB services or activities? We can definitely say yes. And with this, I conclude my presentation. Thank you for your attention.
Thank you so much, Shaksanam. So let's go to the next set of slides. Great. So our next presenter will be Professor Moses Jaloba of the Uganda National TB Reference Laboratory. Professor Moses will be presenting on using TB commitment grants to mobilize resources beyond TIFA to scale up TB activities. Professor Moses, you have the floor.
Thank you very much, and thank you for this session. Let's go to the next slide, please. Yes, using the TB commitment grants to mobilize resources beyond TIFA to scale up pediatric TB activities in Uganda and beyond. The supranational reference lab in Uganda designed 2 TCGs to support rollout of simple one-step stool-based TB testing technique at national and regional level. The TCG1 was implemented in Uganda between April 2023 and April 2024. And the TCG2, a regional or global one, which was implemented between March 2023 and I think it's going on up to July 2024. So what was the challenge we are trying to address? There was difficulty in TB diagnosis among children, as you all know, aged 0 to 14 years. We used the gastric lavage method, which is an invasive method of sample collection that requires actually more skilled people who are becoming rare, and it would require good infrastructure. So the solution was introduce the simple one-step stool testing at national level and cascade to the facility level to increase the number of pulmonary bacteriologically confirmed cases of pediatric TB. Our key outputs that we created a pool of national and regional trainers who went on to do training and rolled out SOS stool testing in selected countries and facilities. We also developed testing material, training materials. Next slide. Thank you. And so in Uganda, these are the steps we did. Initially, we developed training curriculum, SOPs, job aids, and data collection tools. We updated the request forms and lab and treatment registers jointly with the National TB Leprosy Program. We advocated for inclusion of SOS in consideration in 2 national activities, and we engaged various stakeholders at the Ministry of Health, met with civil society organizations, the ministry, USAID, CDC, caregivers, WHO, TB Union, academia, and implementing partners to adopt the implementation plan. This was very key in moving forward. We met with the subnational, the regional and district stakeholders, and we did the facilitated training, held the trainers for national and regional referral hospitals, used the existing national and regional district trainers, conducted on-site training led by us at Uganda, and also regional trainers outside Uganda. We made the follow-ups after we did this training. We did bi-monthly support supervision led by us jointly with the partner staff. We did virtual bi-monthly feedback sessions to share briefs from the supporting supervision visits, site case presentation, and progress. And in terms of rollout and the collaborator scale up, 100% of the TCG sites, which were 56, were trained in the SOS method, which met the grant requirement, but which was very exciting 67 additional sites were trained with additional support from collaborating partners, which was more than double the impact of the regional grant. So this was a faster cascading of SOS method than anticipated due to a successful stakeholder engagement, which is really was a very key achievement here. So there is ongoing collaborations, SRL providing joint supervision to partner trained sites and regional. The regional impact here is that SRL is using this approach in its SOS technical assistance to other countries. So as the SRL, by design, we support other countries. So we use this actually to knowledge to support other countries. Thank you. Next slide. So in terms of mobilizing other partners in terms of stool processing and training, Uganda SRL, we did train at national and regional referral hospitals, at general hospitals, and trained at facility hospitals. So those are the numbers you could see: 22 at national, 34 at general hospital, and at facility 56. But in addition, the other collaborating partners, as I already said, did train. We had WHO Uganda and Pact Karamoja did train at 8 at General Hospital, Infectious Disease Institute 28 at General Hospital, Bela Uganda 12 at Regional Hospital, and Makerere University Joint AIDS Program 19 at General Hospital. So, and 19 at facility. Next slide. So this is, you could see the outcome here. The blue bars here shows the children tested for TB using SOS stool processing starting from August 2023. And you can see the numbers have kept increasing as we see. The red bars are the children which are positive for TB, and as time goes on, you could see that the numbers keep also increasing. And so the positivity is also shown in that gray line, and which is actually also increasing with the time. On the right panel, we see the bacteriology confirmed cases among diagnosed pediatric TB cases before and after introduction of SOS processing method. The green line is April to June 2023, and the blue line is October to December 2023. And overall, you could see what you could really focus on this Karamoja region. Karamoja region has already indicated has covered nearly all the facilities. And where you have all the facilities covered, we have seen an improvement in bacteriologically confirmed cases, and the other ones are following along. Next slide. So finally, the SRL implemented the TCG impact in the region beyond Uganda, as because Uganda is an SRL, and we cascaded SOS to these 12 countries by creating a pool of trainers in 4 countries: Botswana, Liberia, Tanzania, and Zimbabwe. SRL is using their TCG to provide technical assistance to NTPs, engaging stakeholders, training lab technicians and pediatric clinicians, designing implementation plans. And as you can see, this is the footprint. And with the regional rollout, the dark blue countries is where we did SOS training. And the red ones was where we provided technical assistance. And I think all in all, we worked hand in hand with NTLP, with the pediatrician and the lab to achieve this success. Thank you very much.
Thank you so much, Dr. Moses. I believe, has Dr. Mugameri joined us? Do you see him, Yaritza?
No, I'm not sure that he has been able to rejoin.
I reached out to him on WhatsApp, so I think he's had some major blackout in Zimbabwe. Professor Moses, thank you so much for your presentation. I think that what you've shown is how these TB commitment grants can be used not just in one country, but for this really broad multi-country collaboration. With that, I think if we jump back to Dr. Mugameri's slides, I will do my best. I am no substitute but I have had the privilege to work really closely with Dr. Mugomeri and the team at Africa University, as well as the NTP in Zimbabwe. Up a little further down. There we go. Over the last 4 years, actually, in their implementation of their awards. And so I will do my best to fill in. If we could have the next slide, please, Aminata. So Zimbabwe's been really interesting. TIFA is not able to directly fund the National TB Control Program in Zimbabwe. And so that is part of the reason why we fund Africa University. But Africa University works hand in hand with the National TB Control Program. So the NTP gets to decide what they feel is important to be funded. Africa University and TIFA co-design all the awards with the National TB Control Program. And then Africa University works hand in hand to implement with the NTP. And in fact, the NTP really is the main implementer in many of the activities. As you'll see on this slide, over the last 4 years, we've funded multiple awards and a few more. I think we've got 5 more, actually. That shows 4 in here, but there are 5 that will be funded shortly. They're with USAID for approval. So everything in gray are the awards that have been completed, and everything in green is ongoing, and those that are orange are in the works. And what you'll see here is a huge diversity. And I do want to stress one point. There was a question in the chat about, does TIFA grants, do they build the capacity and leave everything in 12 months? And boy, wouldn't that be amazing? We would solve the development nut if we could solve everything in 12 months. But the fact of the matter is some of what countries would like funded, although parts of it can be achieved in 12 months, sometimes they need more time. And there's also this question of sustainability. I mean, many of the things that we fund, we want to be catalytic, right? So you fund part of it, it proves a concept or provides a model for implementation, and then it's something that the country can take forward from then on. But sometimes it takes a little longer, and some countries are really challenging. And we know Zimbabwe is one of those, right, where resources are really, truly scarce. So in Zimbabwe, for example, we funded things like staff capacity strengthening through an online virtual mentorship program. Many of you are familiar with this program. It's called ECHO. And Africa University and the NTP entered into an agreement with Project ECHO. They started 4 years ago. And we're now about to sign the ECHO Phase 4. What's important about this, what they've done with the ECHO is they started quite small in part of the country, and they completed that in 12 months. They got a hub set up at the national level. They then was successful. NTP really liked it, so they expanded to a few more provinces in Phase 2. They got their systems down even more. They then expanded, I believe it's almost countrywide in Phase 3. And in Phase 4, 2 important things are going to happen. One is they're going to complete expanding it to the entire country. At present, they often have over 300 health workers that log in every week to listen to these and engage in these online case reviews and discuss different TB-related issues. We've had a gap of more than 6 months between the ECHO Phase 3 and the ECHO Phase 4 awards, and yet NTP and AU have continued ECHO sessions, which is a real testament to the sustainability and their ability to keep it going. And what's going to happen in this final phase is that extension to the rest of the country, but also an integration into the MOH system. So the HIV program and others are going to join and sort of leverage this great online program for other health programs, and we hope that will help keep it sustained. And I believe that the University of Zimbabwe is going to play a role as well in keeping it going. So it's all to say, not everything is finished in 12 months, but we do always work towards a sustainability plan. And sometimes it takes several phases to get that full package up and running. Other things they funded and focused on in Zimbabwe are TB research, making sense of TB data and getting provinces and districts to interpret data and use the results to make decisions. Have institutionalized DRTB Concilia and also integrated TBQI approach using the National Quality Improvement Guidelines. They've applied that to TB in several provinces, and that was the TB program had not done that yet. They wanted to see what that would look like. And with this small grant, they were able to actually put that guideline into practice for TB. And now they have a roadmap of how to extend that to other places. So that just gives you a taste of what's been happening in Zimbabwe and how it relates to some of what these other countries have done. Next slide, please. Great. So some of the things that I've already emphasized is that Africa University has ensured that design and implementation of all activities is led by the NTP. So even though the funds can't go directly to the NTP, the Africa University and TIFA and USAID have made sure that NTP is still in the driver's seat. There's a lot of co-planning that goes on. The NTP coordinates activities across the 10 provinces. All TIFA activities are integrated into the National TB Control Program's quarterly plans so that each of the staff members has as part of it their responsibilities, what's going to happen through the TIFA activities. So there is no separate work plan for TIFA funded activities. It is all integrated into the National TB Control Program's regular plans. There's an understanding of how the NTP coordinates activities, and that took AU a little bit of time. So as a partner, it took them a little bit of time to figure out the best way to really support the NTP and to work with the NTP. But over time, they've worked out a really rich and effective relationship. And they've also built really good rapport with the NTP. So Africa University has set up a point of contact person for each grant who has a counterpart at NTP. And those two people work very closely to monitor the grant, make sure everything is on schedule, set and plan anything that needs to be scheduled so that it's aligned with NTP and what's happening with NTP, since we all know that national TB control programs across the globe are chronically understaffed. And then the AU focal person coordinates to work with the NTP focal person and to look at the data. Let's go to the next slide, please. Great. So a couple of things just in summary. In terms of sort of what AU has learned, they've learned that capturing the grant-funded activities in the NTP quarterly plans is essential. So early on, where things were hitting bumps in the road, they quickly realized that if they could work to integrate everything into what NTP has planned in general and not keep it as separate grant plans, that was kind of a part of the secret sauce of what made things work. Another thing they learned is to include sustainability in the activity plan. So one of the things that TIFA has done is to work with AU and NTP to say, okay, and what steps need to be taken during the course of this grant, sometimes from the start of the grant, to make sure that this work can be continued going forward. And what would that look like? What does sustainability look like? And then to build in activities that build the foundation for that sustainability into the actual grant activity plan. So when the grant ends, we don't just stop, right? And I think that's something that all of you can relate to. That's something that we're building into many of our programs. But in these short awards, it's tricky. And so we often will take it, as I said before, in steps, where we may have multiple phases, but each step is working one step closer to that sort of full handover and sustainability. The other point that AU want to make is plan ahead and follow up. NTP technical officers are extremely busy, and this has been a real challenge for AU. They have these grants, they're really short, they have to be completed in 12 months. And NTP has global fund, its own government activities. You know, it's a complicated setting. And so planning ahead, working really closely, being flexible has been really, really important. And finally, use time wisely when the activities are moving. So delays from unexpected events like a policy change within the MOH or a polio campaign that, you know, takes all the NTP control program and people and puts them towards the polio campaign. These can be unpredictable. They can have budgetary implications, particularly in a country like Zimbabwe, where the value of the currency is fluctuating quite a bit. They can affect timely implementation. And so using the time wisely when there is a window to get things, to keep things going and to keep it moving, planning ahead, making sure that everything's been integrated into national plans has been very, very essential to the program. and to making things work. And I think, Edmund, I'm going to hand over to you in a minute, but I think we can all agree that this has been a successful program. All right, next slide, please. I think that is it. So that brings us to the question and answer. We do have only about 15 minutes left, so let's keep the Q&A to about 10 minutes. Aminata, over to you.
Thank you, Becky. Thanks, everyone. My name is Aminata Diallo. I am a program officer at JSI with TIFA, with the TIFA project. So to give some time for people to ask some question in the chat box in the Q&A section, we have started question for our TCG recipients. So we're gonna ask in the order of presentation, but we're gonna start with Shaksanam. And the first question for Shaksanam is, what is one thing funders can do to ensure that local partners lead the development and management of awards? Over to you, Shaksanam. Are you there, Shaksanam? Okay, so I guess Professor Moses, you can go ahead and answer the question if you can.
Thank you very much, audience and facilitators. I think the question is very clear. What could we do to ensure that the local partners lead the development and management of the award? I think that has been actually a key lesson here in the TCGs. The local partners, we were involved in identifying what could be the main problem, and we designed these grants with, of course, input from colleagues from USAID and the program, and then we led the implementation. When you do it that way, of course, there is already a country ownership, because you identify the most important, the crucial things which you really want to address, and you also look at the time frame. You look at the resources available in terms of not only the money, but also the human resource within the network. So this approach was really very, very important. And it's a different one, because usually you have requests for quotations where people come with already designed programs, and they may be working in one country, but may not work in another. But this was really a country-focused solution, and we already agreed upon it. And I think the more we do this, the better. And I think we also designed the implementation on how the flow of funds and how we planned ahead, and that really kept us in the driver's seat. And I liked the idea that we could adjust with the budget lines within the funding, within the same period, and that made sure that we could really make sure that we overcome some hurdles where we had some savings. And I think I would leave it at this. But overall, this was a different approach, and I think it worked very well. Thank you.
Thank you very much, Professor Moses. There's a question in the Q&A box. I think that was for Becky.
So I've been answering a couple of them. One of them was from a colleague in the Philippines on the TB Echo, and I will be happy to talk a little bit more about that. And then there's another one on Zimbabwe also. The TWG, is it Technical Working Group? And the answer is yes. So there has been some funding to fund the National TB Technical Working Group. That's a simple answer. But that's been a challenge for many countries. They want to have TB technical working groups, and sometimes the resources and the functions for making them work have been challenging. So that was one of the things that the National TB Control Program wanted to fund. In terms of the ECHO, I'll follow up on that one on the side. But basically, it's extension of community health outcomes. It's a online virtual clinical mentorship program that's actually used in many different countries and by many different, and is, I think those of you that are familiar with USAID and CDC funding, many countries have bought into this, not just for TB, but for HIV and for other programs. So it doesn't have to be TB. The point is that it's virtual clinical mentorship. So it connects specialists and doctors at a hub with folks in more rural and remote areas, or folks that don't have expertise in a particular topic but need to see patients that have those health conditions. And it connects them through case reviews. So in Zimbabwe, they've covered a wide range of topics, everything from data analysis and review to DRTB to TB meningitis. And we do actually, AU just did a wonderful presentation actually on a patient for who some providers in one area changed the course of the treatment based on this engagement with specialists and what they had learned. And the patient who had DRTB and was not doing well did well. And they attributed that change in the treatment to what they learned in this virtual mentorship program. So it's been really quite successful in Zimbabwe, and Edmund can say more about that. All right, I think that are there any other questions to go to the panelists? We have one for Min. Do we want to go to that one, Aminata?
Sure, yes. So this one is for Min or Edmund. The question is, from the funder's perspective, what are some key takeaways you've had over the last 4 years of TIFA, whether for other funders or mission? Over to you, Min.
I think one of the big key things is to be concrete and discrete on exactly what you want to accomplish. I know a lot of people focus on the $250,000 limit or grants, but we have a lot more successful grants that are very phased out, especially such as the ECHO program, where they've been in accomplishing little steps. Because it's very hard to plan out the entire program within the limits of 12 months. But what you can do is very much be like, I need to do this training. And this training can be done in about $50,000 or less. And then you have a workshop, you have a report, you have all these small steps. And TIFA is very well developed to do all the small steps so that you can get up to the combined sum of everything. And by working with the partners, you can identify exactly who the trainings are, who needs to be accomplished, how you're going to make sure the trainings are of good quality, what you want to be included in the activities. And this is where the discussions with the NTP and the local grantees need to come in so that they can identify the concrete actions and the steps need to be done to accomplish the bigger picture. Aminata, you're on mute.
Oh, sorry. Thank you very much, Min. Edmund, I'm not sure if you also want to say something about this question from your perspective, from the funder's perspective. What are some key takeaways you've had over the last year of TIFA?
Sure. I mean, I think we heard from our colleagues, this wasn't an easy approach, if I can put it that way, putting the NTP in that position, transferring money, fixed amount award, there's a lot of lesson. But I think what you can see from the presentation, not only we have diverse organization to the National TB program, the civil society, but also technical area, and it's not easy. But I think the key what we have seen for us is if National TB program and their partner can really define, like Minnie said, what are the particular activity they want to do that is within their ability to implement, given they have multiple things, this is not the only thing. And if they can put in their plan, we've seen tremendous achievement and result coming out of that. I was also going to mention, transferring fund to National TB program, which have never received funding. We fund through the partner, we fund through this, but this was the first time you sit down with them and say, we define for this particular activity, you're going to get a particular grant and you'll be responsible for achieving those grants and you'll be responsible for reporting on those results. I mean, for us, that was an experiment. We have never tested that approach. I mean, to see it happening in multiple countries, in multiple technical area over a period of time is a testament that it really transferring to local organization, building that capacity can work effectively, as Professor Joloba mentioned there. So that's what I wanted to add here. Thank you.
Thank you very much, Edmund, for that answer. I'm not sure if Shaksanan, you can hear us, but there's a question for you. If you can hear us, can you unmute yourself? And the question is from Helen from ADPP. They're also a TIFA grantee. ADPP is a TIFA grantee. It was very interesting to hear the presentation from Uzbekistan. Do you have a lesson learned that there's something you would like to do different if you would like to start the TIFA grant today? Okay, maybe I think Shaksanam is having some audio issues. So we're gonna move on to the next question, and this can be for Professor Moses. What has been your experience implementing fixed amount award and being paid by milestone? Have there been any advantages or challenges to this type of mechanism?
I think, as already mentioned, this was a very different way of funding, and it was a good experience because the turnaround time was very good, and we controlled the budget. We knew what was there, and as I've already said, it was very good because if we do not spend some money in a certain budget line, we get some saving, and we had the whole budget with us, and that helped us either to plan something else or to do some extra activities. So there was still creativity because we really had the funding with us, and we would improve as we go along. So that, and we had a very good discussion with the local partners, and the way the money was funded, and you could see that the achievement was very fast and accelerated. You rarely could have achieved this in any other funding mechanism. So thank you very much.
Thank you very much, Dr. Moses.
Aminata, I think we're almost at time, so we need to unfortunately move to wrap this up.
Sure.
So Edmund, thanks Aminata, and thanks for all those questions. Edmund, do you want to wrap us up, and then I'll do the final housekeeping?
Sure, I can do that. So really what I wanted to say from this presentation, I mean, we started off just laying the foundation why, building partnership with local organization at the local level, which is I think is a key priority for USAID. And TB, we've been able to translate this through TIFA. And you can, from the presentation here, you have seen that the different level of partnership. We've partnered with National NTP program, with the local organization, with the universities, and in multiple diverse technical area. What I really like about what we have learned so far for TIFA is it can be done. It is possible to work with and fund directly local organization at different levels. It's also possible to advance, TB control activities, because we're not funding for funding's sake. You want to make sure, the gaps in the intervention at the end of the day translated improving TB outcomes. And I think we've been able to demonstrate that. TIFA has demonstrated that in a way that we never thought it is possible. So I think for us, that has been the most, big lesson that we have taken away. And as TIFA continue to work with so many organizations in different areas, that is something that we wanted you to appreciate, but also to see that this is really one of the concrete way that USAID has advanced the agenda, but also supporting the National NTP program in different areas. So I hope, I thank the presenter for sharing their perspective. This is just a flavor of so many of those grantee, sub-grantee, TCG that is out there. And we will continue to share and make sure that, we provide as many lessons and we learn as fast as can to move to the next level. So thank you so much. Over to you, Becky.
Thank you so much, Edmund. And as Edmund said, we just provided a small taste today. One of the things that's so exciting about working on this project is how dynamic it is. And it's really been a privilege for me to work with all these different grantees. So just as before you leave us today, just so you know, all registrants will receive the webinar recording. We will review the Q&A and follow up on any unanswered questions as needed. For information and messages related to World TB Day, please follow JSI, TIFA, and USAID social media channels listed on this slide. And finally, I want to appreciate and thank our 4 panelists today, even for those that got knocked off because of technological challenges, for a really great discussion. There's so much more that we could talk about. On behalf of JSI and the USAID TIFA project, we want to thank you for your time and encourage you to stay engaged with us as we continue to learn. We are always learning and improve our localization approaches. We're wishing those that are celebrating Ramadan a month of peace and reflection, and all of us gearing up for World TB Day next week. Yes, we can end TB. Have a great day or evening to everyone. Thank you so much for your time.
Thank you.